Hello everyone. I was having a little technical difficulties with this, but hopefully it is working now. Thank you guys for tuning in. I just wanted to come on and do a little chit chat with everyone I don't know, we haven't done a live chat on YouTube in a long time, and I've got some free time, so I figured, what the heck? So yeah, if you guys have any questions or comments or anything, give this video a thumbs up if you are on right now, because why not? Give it a thumbs up. Hi, Alma or Alma, not sure how you say your name. I just finished eating dinner. Usually I come on and I'm like eating dinner, but this time I decided to eat and then come on. So you're waiting for the Atkins Bass video collaborations. I know it's coming up in July. July we're gonna be together, so the videos may come out beginning of August, but they'll be out. Sorry, my husband rudely called me and interrupted me. So I'm back. So let me go back up and I'm gonna look at all the questions. Oh my gosh, okay. CNA before RN. I actually have a video on this, but I really think getting your CNA before your RN is a great idea if you are able to and are able to have the means, or the program is in your area or whatnot, but I highly recommend CNA before RN. Dang, there's so many things. Love all the bottles. I know, it kind of makes me look like I'm an alcoholic with all these bottles, but it's just a collection. Sorry, going through all the questions. Are there any other specialties I like other than ER or ICU? I really always have been interested in labor and delivery, L&D, but ER and ICU are kind of like the ones that I've always really been interested in. Not to say that I don't like any of the other specialties, but those are just kind of the ones that I prefer, so to speak. Did I have a healthcare job before my RN? No, I actually didn't, but not that I wish I would have done it differently, but I think it would have benefited me for sure. The hardest part of nursing for me was really just the sheer amount of time commitment and organization and amount of new content that you have no idea what it is. And it was just a lot. My husband keeps texting me saying, give him a shout out, and he's staying with our friends Bree and Dylan in Washington. So here is their shout out, hi, so he can stop texting me, because every time he texts me, it pops on my screen and I can't read all the questions. Sorry, okay, getting back to it. You're planning to start your BSN program at 18. Is that okay? What do I think? I think that's wonderful. I went right after high school. I went into my BSN program. I graduated at 21 and got my RN at 21. So I think if you know what you want to do, then just go ahead and do it. What do I recommend to help prep for going into the ICU? Really, you just have to be open-minded to the fact that it's going to be a lot of information and you're going to have to study and be humble about knowing what you don't know. But really, it's like going into any field. You just have to be open-minded and really work towards and learn and put forth the effort to whatever field you're going into. What's the one thing I wish I knew before starting nursing school that you know now? Gosh, that's a good question. I don't really know. I actually thought about this the other day. I was like, I should make a video on this. And then I kind of like, not that I pushed it to the side, I just couldn't think of anything right away. So I was like, I didn't obviously do one yet, but I do want to do a video on that. So stay tuned. I'm going to have to think of an answer to that question. What advice do I give for people who don't know if they want to go into nursing? My advice is to shadow a nurse if you can, or volunteer in the nursing field so you can get an idea as far as what you like or don't like and all that, if that makes sense. Your first live video with me. Yay! Would I consider becoming a pediatric nurse? Yes and no. I really like adults. Adults make their own decisions. Kids usually don't. Well, no, I shouldn't say all adults make their own decisions, but by the time you're an adult, you've lived part of your life, and usually the people who are in the hospital, it's because of the choices they have made in their life. Not all of them, I'm not saying everyone. There are some just really unfortunate circumstances, but with that being said, people make their own decisions, and as kids, I feel like they don't, and their parents do, and that would be hard for me to be around. Opinions on male nurses. I think male nurses are great, just like female nurses. I really don't have a negative opinion. I think I have a positive opinion of male nurses. You love the wine. Yes, I love wine too. Is NICU hard to work in? I'm sure, and any nursing field is going to be difficult to work in. I've never worked in it, so I don't really have an opinion, but I work in the ICU, and it is a challenging field, but I also worked med-surg, thought that was challenging, and tele was challenging. It's really, all fields are challenging. It just depends on what you love and what you're interested in. Did I do an internship? No, I did not. Is it uncommon to use the calculator day to day as a nurse? I only use the calculator for one thing at my job, and that is that at the end of our shifts we have to clear all of our pumps, as far as if there's a controlled substance on, like a fentanyl or Versed drip. We have to go on and clear the pump, and you have to chart how many milliliters the patient received during your shift. Every time or whenever you clear the pump, you have to do that. So fentanyl is a 20 micrograms per 1 milliliter, and sometimes it'll say that they received 1,300, but it'll be a weird number. 1,300 be a little easier to do, but it'll be they received 1,342 micrograms this shift, and so I don't want to do that. I just go on and do the calculator and divide it by 20. But I don't use the calculator for anything else. Everything else is pretty much done for you in the computer. You still need to know how to do it for sure, because sometimes there are emergent situations where you may actually mix a drip or something like that. But for the most part, everything is already in the computer for you. If you're giving 1 milligram of Ativan and the vial is 2 milligrams in 1 mil, it'll literally say to give 0.5 mils on your charting system, so you really don't have to do the math. But it's important to know, because there are times where I have used it, so don't get me wrong. You go to high school with intro to pharmacology. What other classes should you take? That actually sounds like a lot of great classes. I guess anatomy, physiology, if you have that would be a good one to take. What do I think about the LPN to RN route? I think that's wonderful. What makes the ICU so difficult? Is it as difficult as everyone says compared to other nursing fields? I think what makes ICU difficult, besides the fact that it's a lot of information and a lot of equipment and a lot of things going on with the patient all at once. So besides the fact of having to have a good knowledge base and knowing your resources and all that, what makes the ICU difficult is because you see so many sick people, and you see people dying, and you see just terrible situations. You see people who should die but their families won't let them go, and they're just suffering. You see people who should live who don't. You see people who just a ton of hard situations, and you see gruesome, terrible things that happen to people. I've seen people literally bleed out and die, and those are just things that the average person doesn't see. But I think that's what makes the ICU so difficult, is the emotional aspect behind it, and learning how to separate your emotions and not take that home. I mean, there's several shifts I've gone home and I'm just oh my gosh, what happened today? That's crazy. And you really have to have a good outlet, a good community, a good manager, whoever you want to talk to about it, because if you don't, that stuff's just going to eat you alive. Anyways, I digress. I think that's what makes the ICU so difficult. My husband comes back he'll be back in 2.5 weeks, officially out of the military. Dunzo. Am I planning on going to grad school? I don't know. I'm still wishy-washy. Where's my polka dot lunchbox from? That's funny because I actually haven't used it in like months, but I still have it. My mother-in-law got it from me, and I want to say she got it from like Ross or TJ Maxx, one of those types of stores, but she got it for me a long time ago. I've had it for like over 2 years. So Nilofar, I'm not sure how you say that. It says that she's freaking out. She just signed up for registry to work med surge. I'm just too scared. At the same time, you're saying, I'm struggling financially. Please help. Any advice? With any new job, it's going to be overwhelming. And my biggest piece of advice is to just go in open-minded and have confidence in yourself. And you're going to adjust. There's always an adjustment period when you first start off with the job. You don't know anyone. It's difficult, but you're going to get into your routine quickly and you'll be okay. When taking prereqs, it's better to take the harder classes first or all the classes hard. Every class is different. It really depends on what you're good at and what your interests are. So I don't really have any advice as far as how to take those classes. Is the NCLEX as hard as they say? Yes and no. The NCLEX is difficult. Like if you had to get 100% on it, absolutely, that'd be totally difficult. But really, there's a passing bar line for the NCLEX. And if you get a question right, you go above the bar line. If you get a question wrong, you go below. And the more questions you get right, the higher you build yourself above this bar line. So really, I don't know like what percentage you have to get, but if you kind of know how to break down the questions and answer them, it isn't too difficult. And anyways, it is difficult. It's hard. Like I didn't know a lot of the stuff on the NCLEX, but you're not going to. And that's the point, is not to really test your knowledge as far as like, I don't know. It's more of like how to be safe, how to make good nursing judgment choices versus like having to know how to diagnose someone, because that's not our job. How many patients do I get in the ICU? 1 or 2? Depends on if they're 1 nurse to 2 patients or 1-to-1, like 1 nurse to 1 patient. You're in high school and want to do nursing and took a lot of classes and volunteering for it, but you're slowly losing interest. Should you continue or go all the way? That's a totally personal decision and up to you. I would never encourage someone to do something that they don't want to do. Maybe there's something that you're more interested in, or maybe not. I don't know, but I think that's a personal decision. Everyone on here right now should go and like this video. What do I think about grad school, MSN, DNP? I think they're great. I don't know what I want to do, but I think it's great when people go back to school. What is ICU? It's intensive care unit, sickest of the sick. What's the hardest part about being an ICU nurse, and how did you overcome and deal with it? I think the hardest part for me at first was just how sick people really are or were, and all the stuff involved in taking care of them, all the charting involved, all the people involved. And as a nurse, you are the center of that person's care. Everyone comes, I don't use the word through you, but pretty much everyone comes through you, whether it's renal, cardiology, social work, physical therapy, occupational therapy, speech therapy. Everyone comes to you to ask you about the patient, and you have to know that information. And that's like how it is with every nursing field, but in the ICU, you have to really know your stuff, because if they come up to you and they ask you all the questions, you're like, I don't know. They're gonna be like, why are you here? What have you been doing? How often do I use math when working, like statistics and calculus? Never. I do math during the shifts, though. Like, you do have to kind of calculate stuff, but most of the time it's calculated for you. But you still should know how to do it, because in emergencies you will have to do calculations. How do you wear your hair to work? I always usually wear my hair in a ponytail, or a bun, or a braid. It's always back. I want to put it back right now. Sorry, I'm kind of like way behind on questions. Oh my gosh, I am like so behind. Okay. Do I like ICU or med-surg? I like ICU better than med-surg. Just my personal preference. How to deal with nurses that don't like students in clinicals. You're a first semester student and it's tough. You know, this is a hard situation because you usually don't get to choose who you're paired with when you go to clinicals. And it's really unfortunate that nurses can be rude towards students. I really try to be very positive and like let students do pretty much everything, because by the time they're in the ICU, they're last semester students and they're about to graduate. But at the same time, you have to like, I don't know how to say this in a nice way. If a student is about to graduate, you really want to make sure they're prepared for the graduation. So if there's a big red flag, that's something that needs to be addressed because that student's about to graduate. But the best thing you can do, honestly, is to be a good nursing student is to come prepared, take report. I can't tell you how many times I am paired with students who just don't take report. Like, even if you don't know 90% of what is being said, write it down and we can talk about it. You can ask questions. Students who ask me questions, that's always a good thing. But, you know, sometimes the nurse can get upset when you ask too many questions. But, like, I'm not that way. But, you know, anyways. And the other biggest thing that nurses, well, at least me, but most nurses enjoy is when you're motivated to learn and you're willing to do things. Whether it's putting in a suppository, something that like no one really likes to do, or whether it's putting in an NG tube or a Foley or something like that. My husband keeps texting me things. Stop texting me during this, because then it distracts me. Whether you're doing something you do or do not want to do, it doesn't matter. Like, show that you're motivated and willing to learn that. And to do it, because there's been times where I've had students and I'm like, hey, do you want to help with the tube feeding? They're like, oh no, I'll do the next one. And it's like, no, as a nurse, you need to be doing this stuff. If you're about to graduate in 3 weeks, you should be doing, I don't want to say doing everything, but you should be trying to do the most that you possibly can for your abilities. Anyways, I'm on a little soapbox. I've had a few students, I don't use, not recently, just in general, I've had a few students who just haven't really cared and weren't interested in the ICU or weren't interested in what was going on, and so it makes it difficult and challenging. And as a student, you should know when you're paired with a nurse, you can be used as an asset. You totally can. You can help with turns and all that stuff. But most of the time, it puts the nurse behind because they're explaining everything and they're letting you do things and all that, which is totally fine. And I don't mind being behind as long as it's someone who's interested in learning and what I'm talking about. But if you're not interested, then it's like, why am I putting forth all this effort to try and teach someone and let you do all these things, and I'm getting behind when you don't even care, you don't even want to do it. Anyways, I'm done. I'm off my soapbox. How are the pups? The pups are good. They're tired. They went to the dog park today, so. There's Ivy girl. She's sleeping. I think Blue's on the other side. Yeah. Oh, he's sleeping on his water bowl. Oh, you woke up. Anyways. Any tips for getting your face as sleek as my Nurse Bass? What's up? Oh, sorry. Gotta put this up a little bit. Okay, I'm reading questions. Sorry, I was like so behind on questions because I went on that little soapbox tangent there. Do I wear a uniform when I go to work? Yes, we have to wear navy blue scrubs. Sorry, I'm going back reading questions. So a lot of these are like duplicates, so I'm trying to kind of pick out the good questions. Do my coworkers tease me about my YouTube channel? Yes and no. Everyone's really supportive, but sometimes they will tease me. But I don't know how many of them actually watch my videos, or a lot of them just know about it, but a lot of them don't really go on and watch. I mean, maybe they do. I don't know. Some people do, I guess. But a lot of people tease me, but then they realize like how many people follow me, or that this has actually become like, it's definitely a hobby, but it's become kind of like a part-time job, part-time like income. And then they're like, oh, that's cool. How do I do that? Is everyone giving Nurse Bass tips on how to do his makeup? Sorry for the pause. I'm reading questions. There's so many. Do I work night shifts? No. I work days, which I'm super happy and thankful for. I'm definitely a day shift person. Do I like jazz? I guess. I don't know. I don't dislike jazz. I don't really listen to it, but it can be nice. You're scared because you don't know if you want to be a nurse or study medicine. To be a surgeon, you like both. You could be a surgical nurse. What do you do if you get stuck or forget how to do something? You find in your Sims you panic and often forget how to go about a certain situation. The hardest part about simulations is they expect you to know what to do, so you can kind of like, it's almost like a video game. You have to do this to get to the next step. And if you don't get there, then they're like, it's just like this awkward time. You're like, I don't know what I'm supposed to do. It's like you have to do one thing right to get to the next step, to do that right, to get to the next step. And then finally you're done with the simulation. Like that's how the simulations work. So real life is kind of like that, but not really like that. Like when you have your own patients, like you do what you want in the order that's best for your patients / you. And you're not worried about all these people watching you and what you're doing and trying to like complete that first step to get to the next step. So simulations, they're great, and you should definitely work really hard in them and take all the knowledge you learn from it, and don't take that for granted. But at the same time, like that's real life is not like that. I remember like some of the mannequins at my school, like you'd be listening to breath sounds and you wouldn't hear some of them. Most of the mannequins you could hear things, but if something wasn't working that day or whatever, you'd be listening and you'd be like, I wonder what the breath sounds sound like. And then the little person would come through and be like, there's crackles. And it's like, this is just not realistic. But you know, you gotta do your best. Registry nurses, do you have any med surg experience before you've gone registry? Because usually when to become registry, you have to have experience. At least where I work. That's how it works. Why am I so red? Look at that. Just kidding. Oh my gosh, there's so many questions on here. Did I work night shifts after I graduated? I did not. I worked a mid shift from 3 to 11:30. Any funny nursing stories? Yeah, I have tons. I'm just trying to think about like what I can actually say like on the YouTube. I had a patient the other day. This is kind of funny, but kind of like not funny, kind of inappropriate, I guess. But this patient was an elderly gentleman and he was very very stuck in his ways and kind of mean. Yeah, definitely mean. But this patient had not been up in like 3 or 4 days. He's elderly. He's very weak. Physical therapy could just barely get him to the edge of the bed. And he said he needed to go to the bathroom and he wanted to walk to the bathroom. And I said, like, sir, I am not going to be able to get you up to the bathroom safely. So since you have to go so bad, let me grab another person and we can either get you on the bedpan or we could do the bedside commode. And he's like, oh, I'll do the bedside commode. So I go and like hunt one down. And you know, if you're a nurse, those little suckers are so hard to find. And you like hunt them down and you're like running around. And by the time you bring it in the room, you're like practically sweating. So I'm like running around, I get one, I get a commode. I find someone to help me. And we're about to get this guy up to the commode. And he's like, who the F are you to be telling an 80-something-year-old man that he can't go to the bathroom when you're like only 15 years old? And what I wanted to say was, sir, how long have you been a nurse? But I didn't say that. I don't remember what I said. I said something like, I'm sorry that you feel this way. I said, but I cannot get you to the bathroom without you falling. So this is just gonna have to be what we do. Anyways, so that's one funny story. I guess it's kind of funny. Oh my gosh, sorry, there's so many things. Oh my gosh, there's someone's on here trolling. It's fine, just ignore them, guys. Yeah, so grumpy old man. I also had a patient who was having difficulty urinating and kept wanting to go on the bedpan, saying they had to go so bad, and they like weren't going. And so I was like, let me feel your bladder, or I kind of pushed on her bladder to see like if I could palpate it and feel if it was firm. And she goes, oh, that helps. And she's like, and she's laying in bed like with her legs up. She's like, oh, that helps. She's like, keep pushing right there. And she's like, push. And I'm like, ma'am, let me give you your hand so you can push on your bladder. And she like literally wanted me to push, and she was like making these like moaning noises. I was like, no, we're not going to do this. All right. I'm trying to figure out. Oh, okay. I figured out how to block that person, guys. Sorry. Let me see if I can remove them. Ooh, I can put someone in timeout. I didn't know I could do that. That's kind of cool. It's kind of funny. Like, oh, you're going in timeout. Too many rude comments and nasty comments. You're going in timeout. I'm 23. 23. What other funny stories do I have? I like telling them. I just want to make sure that I'm respecting patients' privacy and all that information. Big eyes. Everyone keeps saying I have big eyes. I know. Yeah, I don't think he should comment anymore. I think he's in timeout, so I don't think he can comment. I can't believe I have 150 people on here. It's crazy. You thought I was like 30. It's because I've got wrinkles. I'm kind of getting wrinkles, guys. Like, especially right here. Like, if it's sunny and I'm squinting, and then my makeup creases, and then it, like, looks worse. Oh, wow. Okay, there's more people. More people going in timeout. Put user in timeout. That's so funny. Oh my gosh, there's a lot of people saying mean things. I don't know if you guys can put people in timeout, but you guys kind of gotta help me out because it's hard to read all these comments. And then my husband comes home in 2.5 weeks. 2.5. People must be bored. I know, like, who gets on here and says those things? It just like blows my mind. Oh, you can only report them. Oh, well. Nurse Bass, you got my back. Reporting everyone. What is a telenurse? A telenurse is someone who, it's like a step up from med-surg. You can do a little bit more. Sometimes they have like drips, but they don't usually titrate them unless it's like a heparin drip. And they monitor like the telemetry strips. Yeah. Did I work while in nursing school? Yes. Are Jesse and I going to travel when he finally gets out of the military? No, we need to save some money. A telenurse answers phones all day. Yeah, they're on the telephone. My dogs. You want to see my dogs? Of course. There she is. So sleepy. Look at her cute little face. So cute. And then Blue's over here sleeping. Look at them, so cute. They're so cute. When was I able to perform IVs? In nursing school, after we learned it, we were able to. I actually just did an IV the other day. We don't do them a lot in ICU because they've got central lines and all that stuff. And yes, they are golden retrievers. And oh my gosh, there's so many questions coming in. Sorry. And this patient, his IV was starting to go bad. It was just leaking everywhere. You know, like it still could pull back blood, but it was just leaking. So Nurse Bass is texting me now, and he knows better. Okay. And anyways, I digress. So I told the patient, I'm going to put in another IV because this one's about to go bad, and you need to have at least one working IV, ideally two. And he goes, oh, they only can get IVs in me with the ultrasound. So I said, okay, well, let me just take a look. If I don't see anything I'm confident in, we'll get the ultrasound and we'll do it that way. I'm not ultrasound certified yet, but I actually take the class on the 6th of June to become ultrasound certified. So I will shortly be ultrasound certified, and it won't be a big deal for me to go get one, but I'm not now, so I have to have someone else do it. And that's just kind of inconvenient for everyone. So anyways, I found a spot for the IV, and I got it right away, and it went, and he was like, oh my gosh, you must be really good at IVs. And I'm like, not that good at IVs. I'm not terrible. I'm not the best. I'm kind of like a little bit above average, I would say. But anyways, little nursing win. I kind of like patted myself in the back. Wildcats are Sun Devils. Sun Devils, duh, I went to ASU. Oh, there's so many questions on here. My favorite nursing shoes. A lot of people are asking this question. I'm wearing Skechers right now, and I like them. They seem to work really well. Mark J, you're going to go in timeout. Sorry. I just think that's so funny. It just cracks me up. Like, oh, timeout. Have I ever heard of GCU? Yes, I have. What do you like to do the most during shifts? It kind of depends. I'm like a skill person. I like when we do or procedure person. I think it's fun when we do those things, but I don't like to chart. But I don't know. I don't really know what my favorite part is. I have a lot of things I like and dislike. My favorite part's going home at the end of the day when I don't have to come back for a couple days so I can sleep in. Are you friends with doctors? Yes, I am. GCU is a school here in Arizona. So, little sneak peek for all of you that are on here today. I did a different type of video today, and I'm actually super excited to edit it. Seeing what time it was. And I did one on weird things nurses say / do, and it's going to be really funny. I think it's going to be really funny. I haven't edited it yet, but just like with me doing it, I was like, this is going to be funny. So, I think you guys will enjoy it and be able to relate. But anyways, I guess we'll end on that. I am going to clean up and get ready and go to bed because I've got to get up early tomorrow for doing a bunch of things. I'm not working, but I hope you guys have a great night. And yeah, so I will talk to you guys all later. And thanks for watching. And make sure you give this video a thumbs up if you haven't already. Okay, bye.